Good morning. I wish I could have been with you in Edinburgh as you meet to discuss planetary health. In many respects, the statistics, the numbers and the research have pointed us for decades towards understanding more the connections and the challenges we face. But just for those who may not be aware of some of the latest data, let me repeat a few numbers just to demonstrate how significant, for instance, the finding is that almost a quarter of global death attributed to unhealthy environments. The evidence for action on planetary health is therefore hard to ignore. Air pollution kills 7 million people each year. Ecological and environmental factors drive the spread of disease from Ebola to Zika virus. And by 2050, climate change could impact agricultural production, leading to an additional 500,000 deaths because of dietary and weight-related factors. Our very survival today relies on the health of our planet. But we must sound the alarm without inciting fatalism. To do this, let's talk about successes as often as we talk about obstacles. This year, a NASA study used satellite data to confirm that the Montreal Protocol is decreasing Antarctic chlorine levels, and the hole in our ozone layer has begun to shrink. Innovation and incentives have brought down the price of renewable resources of energy, and we can learn from public health successes. The price of HIV drugs was lowered from $10,000 per patient per year in 2000 to less than $1 a day today. Smoke-free public spaces are increasingly the norm. It's time for a social movement around planetary health, one which addresses the needs of the poorest, brings health equity and environmental justice communities together, and new partners to the table. This month, I had the privilege to sign a memorandum of agreement with the Director General of the World Health Organization, committing our organizations, UNDP and WHO, to scale up multi-sectoral responses to health challenges arising from climate change and environmental problems, and to do so in the context of the SDGs and the attempt to move towards universal health care. None of us can tackle the scale and complexity of planetary health challenges alone. Success requires contributions from all of us. Academics to create new evidence through interdisciplinary research, the private sector to deliver clean and affordable solutions, civil society to witness and advocate for the most vulnerable, and finally leaders at the local, national and global levels to exercise their power bravely. I commend the Interaction Council, a group of former heads of government who have come together for collaborative action on One Health for people and the planet. Work at the nexus of environment and health is critical for achieving the Sustainable Development Goals and ensuring that all people can live in dignity. I wish you a very fruitful discussion and thank you for the opportunity to address you by means of this message this morning. Bye-bye.